Very good morning, everybody. Today, I have the honor and pleasure of having with me Dr. Neethu. She is ranked 29 this year's NEET PG exam, and I'm very honored and proud to be sitting next to her today. She is a DAMS Calicut student, and she joined us for the DAMS Sky regular course this year. And I'm very entire DAMS team is very proud of her achievement. To
Thank you,
begin
sir.
with, I'll ask her to introduce herself, and we'll talk about her journey in this event and try to take out some inputs for the people who are preparing for the next year, how they can plan their studies. We'll try to take out some information from her. So, how are you feeling?
So before starting to say anything, I would like to thank the entire DAMS team, especially Sumar sir and Deepthi ma'am. And I would like to thank my parents also, especially my mom. She has always been motivating me during my UG period as well as during my entrance preparation. My sister, she has made my UG period learning easier. She used to read every textbook from page 1 to the last page and underline and keep everything. So it was easy for me. And my college, I belong to Calicut Medical College. So all those teachers who have taught me from first year till my final year. Then I would like to thank DAMS Calicut Center. We had separate sessions there. We had separate class exams, subject wise as well as grand tests towards the end, even image questions also. So yeah, I would like to thank Rahul Rajiv sir and Yas sir for.
Yeah, great. So now I would want to know from you, your journey, that you were in the DAMS regular course in the DAMS Calicut Center, and this was your drop year. So
Yeah.
in the first attempt, you were telling me when I was discussing with you, you had a rank of
4008.
4,000, and then you decided to repeat again.
Yes.
Can you tell me why you decided to repeat
Because
again?
I was always, I aimed at a top branch. I wanted either radiology, my
Okay.
first preference, or dermatology.
So,
So I didn't
you
have to think
did not want
twice.
to compromise.
No, I never wanted to
Okay.
compromise.
And even if it would mean one more year.
Yeah, I didn't think one more year is something really big. Once you want to chase your dreams, it's not a big thing.
Okay,
To spend.
because what I have learned is that every time you get a borderline rank, there would be a lot of pressure. People will say, "Take it,
Yeah.
finish off. Why you are giving one more year?" And so, what was going on in your mind? Because a lot of people will be in your similar situation
yes,
this year.
yes.
So, what was going on in your mind at that time?
No, actually, I didn't do much preparation during my internship. So only during the last 3 months did I prepare for NEET last year.
So
because-
that helped, that like
Yeah,
your
I was
decision, that you
just-
knew
yeah.
that if you had in you, if you
Yeah.
could put in hard work,
Yes, yes.
things would be different.
Yes.
So that
just
helped.
With 3 months, if I could 4,000, so I thought I should spend one more year.
So the idea
Yes.
was that you did introspection. You
Yes,
you
I did
realized that okay,
analyze.
you had not put in so much effort,
Yes, yes.
and
yes.
you had a borderline kind of a rank, but
Yes.
you wanted a top branch,
Yes,
so you
yes.
decided to repeat,
Yes.
and you never wanted to compromise.
No.
that-
And I could repeat from my home only. That is the
Yeah.
most comfortable thing.
And we opened that DAMS
Yes,
center,
the correct
Cali-
timing.
Calicut. So like
just
it was a
when I-
God sent signal,
Yes.
that okay. Okay. And so now tell me more about the way I see your rank and I see your improvement, and I think it is very inspiring for people listening to us today that you could start from borderline rank and to reach to a two-digit rank.
Yes.
You could do that.
Yeah.
And I want you to now can look at like my minute aspects, and talk about say, let's look at some landmarks that happened in the last year. Did you give the DAM CBT?
Yes, I gave. I got a rank of 28.
And what is your real rank in NEET?
29.
Same rank you could almost get. So I think this is a very good correlation that we could make with DAM CBT this
Yes.
year. And I think DAM CBT is a very good landmark for everybody to give, because
Yes,
it is
yes, yes.
at a very right point. You still have time to improve.
Yes, yes. Actually, I haven't even finished my subjects on
Okay.
October 16th.
Yeah.
Then I gave it. So I think everyone should give it.
And
No.
so did you enjoy because you're from Calicut, and DAMS is relatively new in that place.
Yes, yes.
So, and many of the things that we do would have come as a first time to you, like
Yes,
DVT
yes,
session,
yes.
or the mop-ups that we do,
Yes,
ECG
yes.
mop-ups. So what was your opinion on them?
So I think only with only class notes and revising them, I could get a two-digit rank. So I was thinking it would be really nice if you have the notes, if you have joined, during the UG period itself. If you have the notes at the beginning of the internship, you just have to revise it, and you even if you're aiming at the top rank, you could get it.
So
That's
no-
what I feel.
Okay, and with your experience, you feel that if you had the choice in earlier time,
Yes.
you would have actually loved to do our classes in your third year or fourth year and
Yes.
an internship, finish them
Yeah.
off.
I don't want anyone to become a repeater actually, because though you have 1 year, there is a lot of stress also towards the end.
So you
I
feel the
think
joining early is the
yeah,
key
I
thing.
think we need to start early.
And I feel that looking at the trend also, what you are saying today, I feel when I talk to students all across India, most of the students are now looking at that joining early part,
Yes, yeah.
because now everybody understands. Like many years back, people used to say, okay, I'll get in the first drop year, second drop year, but now everybody feels the value of
Yeah,
time.
Yes.
You have to because already as doctors we have that disadvantage of having longer courses,
Yes.
and we are already missed out on our entire youth in studies, and like people want to now accelerate. Yeah, that happens.
And there is no stress also when you become a repeater. We
So
are
how
spending-
did you handle stress in the last year?
Okay.
Mommy, I think your mother.
Yeah,
you
my
told about-
mom is always motivating.
That is something that I feel that if you have a good buffer system at home,
Yes.
that kind
I
of
didn't have
takes-
to go anywhere for motivation.
yeah, mom would
Yeah,
always
my
tell you
mom
do
was
it.
there.
Yeah, and I met her in the morning. I'm sure that she is very glad that you are now
Yeah,
going to
she is
take a
very
branch
glad.
of your choice.
Yes.
Yes, I'm so happy for you and your entire family. I'm sure everybody should be proud of you
Yes.
for your achievement. Now, second thing that I want you to now tell about is the mop-up sessions that we did. That is something that was that's very close to my heart. Like I did some sessions on ECG.
Yes.
I got some sessions on different topics. And a lot of people, some of the students actually missed the session. They did not come for the ECG session.
Yeah.
They said, "Sir, who is going to ask ECG?"
Yeah. Even
And
I was
when-
thinking.
when they opened the paper this time and they realized.
There were a lot of ECG, sir.
So the reason I did was because I feel that it is my duty to do a well-rounded course. I can't leave ECG, I can't leave EEG. We do everything. Unlike what I've seen is some of the institutes or some of the people would claim that they can do everything in 5 minutes, 6 minutes. That doesn't work. So now can you tell me about bit about the exam that you really faced, the NEET exam that you
Yeah.
faced? What do you think was that exam all about? The level of the exam, the kind of distribution of questions. What do you think that people who have never given NEET, what do you think it was?
So I think there is all type of questions. There are few questions which I haven't ever heard about,
Okay.
but majority were easy questions. Majority were from notes. As
Class
if I-
notes that you
yeah,
had
class
made,
notes
yeah.
alone. Not even from the test we attend. Everything majority were from note. So I was thinking if anything outside notes come, okay, I'll leave it. And I did that only, and I got this rank. And yes, final year subjects are important. OBG, surgery, medicine, pediatrics. Then SPM is important. And I think second year subjects also is important.
Now, if we ask you to go deeper into, like you said, PSM, Obs Gynae, like can you talk about some topics that you would want people to read and not miss out if they are aiming for the next NEET exam?
Yeah, I think from pharmacology, that adrenergic cholinergic system, that is always asked.
The neurological ANS, CNS part. Yeah,
Pharmacology,
okay.
that I used to always get one question. Then PSM statistics, epidemiology, that part. There were a
I
lot
think
of course case
this time
control.
whenever I've talked to anybody who's got a good rank, top
Yeah,
100, most people have mentioned epidemiology and biostatistics. So I think if you're preparing for NEET next year, please make sure that you're good at these topics.
Yes.
Any more topics that you would want to mention?
This year ECG was there.
ECG was a game changer, I'm
Yes.
sure. Between the rank 100 and 29, I think ECG
ECG
was
is
the
very
game
important.
changer. Yes.
Then
And
images,
have
a lot
increased.
of images. Yeah, I
yes.
was really happy to see a lot of images, because being a Damsonian, it's our strength. Images when
we
see
are
these
proud that when you say that you are a Damsonian, we are proud because we are proud of every student of ours, and we are happy to be a part of your journey.
things. Yeah, thank you, sir.
And now I would want to ask you some personal questions now.
Yeah.
What is your key strength, like in one word or two words? Can you describe your key strength? Like somebody would say hard work, somebody would say perseverance. So what is your key strength?
For me personally, my parents. And yeah, hard
Parents.
work is also really important.
yeah.
Like parents, they were always there.
I'm very happy to hear from you, because sometimes I feel that when we become successful, we forget the contribution that our
Yeah.
parents had made. And I am very happy that she started the interview by thanking her parents.
So I feel that behind every successful child, the role played by the parents is really huge.
Yeah, I totally agree, because sometimes even I feel that what we achieve is if they hadn't worked so hard for so many years with you, it would not have been possible. So
Yes.
so it is great that she is wanting to thank her parents, and I'm sure everybody should attribute their successes to their parents. Yes. And now, Neethu, it is such a pleasure to talk to a person like you who's so grounded and so settled now. Which subject are you now looking at? You said radiology, dermatology. Now,
Yeah. I
what is
think more inclined towards radiology, because once I heard Sumar sir's class, earlier I thought it was not understandable, to read an X-ray, to read an MRI and all. But now I feel, yeah, it's understandable. Once you attend sir's class, yeah, you start loving
that is,
radiology.
thank you so much. And now you have heard many of our teachers from that satellite medium.
Yeah.
Now, do you remember anybody's name? Do you want to mention anybody?
Yeah, so I was not
that
that
you have not met, but you saw on the TV.
Yeah,
Uh,
anatomy sir,
Anatomy, sir.
Pratipava sir.
Yeah. Dr. Pradeep is one of the gems. He makes it flow.
Yeah, he was very prompt. I was, when I had doubts, I used to ask in WhatsApp. He was very prompt. Every
Yeah.
time he used to give answers very quickly.
And what about the DAMS Facebook group? Were you a part of it?
Yeah, I'm part, but I was not that active.
Yes.
I-
yeah.
Now I think I should have been
less
more.
active on the
I was
Facebook.
less-
Otherwise,
yeah, otherwise I'm less active. That's
Yeah.
the problem.
Uh,
I couldn't make it a habit to be active.
But I've seen is people who are otherwise active on
Active,
Facebook,
they'll
they
be
become
more
more
less
active on
active.
this. Yes, I understand that.
Otherwise, I was
Uh,
not at all active. So I
uh,
always tried to make it a habit, but I couldn't.
And did you utilize the testing mechanisms that we use, like class test, subject-wise test, grand tests? What is your take on that?
Yeah, so it's really useful. I think you should give all the exams if you are a repeater, especially.
I feel that people should give exams, because
Yes, sir.
what happens
Just
is
it will
if you
improve.
keep reading and you don't evaluate
Yeah,
yourself, that
there is-
defeats the purpose.
Yeah, it really improves your recall.
Yeah.
You'll recall things. That's important. Frequent recalling is really important. So I think everyone should give.
Now, if I summarize what we have learned from you today, is like, one you say is that if you have a chance, start early.
Yeah.
That is what her first message. Second is, she says that don't run around too many things. Have
Yes.
faith on your classes, have
Notes,
faith on your
notes.
class notes, and then do them again and again.
Yes.
And how many revisions did you do?
So I think twice I revised after
Okay.
October.
Okay.
In between, I revised some 5-6 subjects once,
Okay.
extra once.
So maybe
one time extra.
if I say like one big reading and 2 revisions,
Yeah,
like
that would do.
3 would be the.
Yeah.
And this is a very important thing to understand, because many people would say, sir, how many times to revise? And I have seen, and you have also seen with the series of interviews that we have done, most of the rankers have said 3. 3 is because you can't actually do it 10 times. If you do it 10 times, your content is too less. So you
Yeah.
have to have that content and then do it, twice, thrice. That
Yes.
works out.
And I think you should not go behind a lot of guidebooks. I didn't touch any. I
So you
don't
did not do any
think-
guidebooks.
No, I didn't
so
do any.
was there a lot of
guidebooks.
pressure around, like many
No,
people
yes,
would be
like-
buying guidebooks? And
Yeah,
like,
even I had it at home. My
Yeah.
sister is also a medical. I
Yeah.
have a huge number of guidebooks at home.
yeah. So
But
how
I
did you
don't
resist
know.
the temptation to touch them?
I didn't have much time.
Okay,
No
you
need to
did not,
resist.
yes. But what I've understood is that
I did write and took all the names of the guidebooks initially
Yeah.
February, but
Yeah.
I didn't
you didn't read.
read it.
So again, what I've seen is what has happened this year is this exam had a lot of new questions, and some of them were actually the first timers, like ECG,
Yeah.
classically not asked. Now they have asked. So what has happened is people who were doing too much of the classic guidebooks, some of them actually have suffered.
Yeah, they'll omit ECG
Yeah,
and all.
and they've suffered, and their ranks have actually fallen down. Another thing to understand is many of these guidebooks have collected questions from 1998, 1999, and none of that is being asked. Please look at the date today. We are in 2017 already. You can't medicine 20 years back. What was being asked is actually history now. You know, that should be put in the history textbook, not in a medical curriculum. But you know, but you keep reading all that, all that, all that. That exam body has evolved. They are not asking that kind of questions any longer. So that is a very key message to take home.
So I
that
think questions at the back of CRS can be done.
Yes. So what we've done is we've added a lot of questions on the
Yeah.
CRS. And
End
this
towards
year
it.
we have actually upgraded the CRS to have all that color images. We've upgraded
Mm.
them. You will like it when you see it with your juniors.
Mm.
And we've added a lot of questions so that you get a place to do MCQ practice without wasting too
Huh.
much time.
Yes.
Yeah, this we're doing. And now what we want from you is a motivational line. Okay, it's a very tough thing to do, but I want you to give a motivational line, and so that people listening to you get inspired to do well.
Yeah, I would say start early. That's very important.
That is the technique. I say motivate.
Yeah.
Motivate them.
Okay. Yeah, you have to dream a lot.
Dream a lot. Yes,
I
that's a
used
very
to
big
dream
thing.
a lot.
Yes. So what I appreciate about her is that she could have taken a PG last year at her rank. Many people at her rank would have compromised, but as she said, she kept dreaming,
Yeah.
and she was sure what she wants in life. And she
I
said,
wanted to meet sir also.
That is so
I
kind
dreamt of me.
she wanted to, actually do this interview, and she wanted to
No, I
make
wanted
a
to
V
meet sir.
with the as a topper, and it is an honor for me also to meet her. And if only you could have told me this in our Facebook inbox, I would have come over to meet.
Oh.
We are so proud of your achievement. You've done so well. Now, finally, I want you to now motivate. It's a very tough
Yeah.
question. I did not tell you this before. Motivate people in your parent language. Say something in Malayalam and make them, push them.
Okay.
Because a lot of people
Oh.
from your college would be listening to you. And tell me
Okay.
translation later on.
See, നമ്മളെപ്പോഴും എപ്പോഴും വിചാരിക്കും അങ്ങനെ വലിയൊരു ബ്രാഞ്ച് എയിം ചെയ്താൽ അത് കിട്ടൂല അങ്ങനെയൊക്കെ വിചാരിക്കും. പക്ഷെ അങ്ങനെയൊന്നുമില്ല. ഐ തിങ്ക് അത്രയ്ക്ക് നമ്മൾ പരിശ്രമിച്ചാൽ കിട്ടാത്തതായിട്ട് ഒന്നുമില്ല. അതായിരുന്നു എൻ്റെ അച്ഛനും അമ്മയും എപ്പോഴും പറഞ്ഞിരുന്നത്. ലൈക്ക് ഇഫ് യു വോണ്ട്സ് എന്തെങ്കിലും വേണമെങ്കിൽ അതിന് വേണ്ടിയിട്ട് അത്രയും 100% എഫേർട്ട് ഇട്ടിട്ടുണ്ടെങ്കിൽ അത് എന്തായാലും കിട്ടും.
No, please translate for me.
Okay, I told them that nothing is impossible.
Yes.
If you aim even for a top branch, it's possible.
Yes.
Like you have to put in your 100% effort.
And-
Then it
and
will come true.
Yes.
That's what my parents
I
used to
actually
tell me
appreciate
always.
the values that her parents has given her, and the positivity that she has towards life. I sincerely wish all the best to her, and I'm sure she will make a great doctor, and she'll make an awesome radiologist in future. Heartiest
Thank you,
congratulations to her. We wish her all the best from the DAMS family. Thank you, and
Thank
God
you,
bless
sir.
you.
Thank you.